Hello guys, in this video we are going to see the anatomy of the Eustachian tube and its disorders. This Eustachian tube is also known as auditory tube or pharyngotympanic tube, guys. You know that it connects the anterior wall of the middle ear to the lateral wall of nasopharynx. This Eustachian tube is normally 36 mm in length, where the lateral one third, this from the middle ear till the isthmus, this is the bony cottonage junction. This is the bony part, which is 12 mm in length, and the second part is the medial. It's the 2/3, which is cartilaginous, and it is 24 mm in length. The isthmus is the narrowest part of a Eustachian tube, and the junction, this is known as bony cottonage junction, known as isthmus. This Eustachian tube lies at an angle of 45 degree. You can see this is at an angle of 45 degree, the normal level, from the normal level. Okay guys, the main functions of the Eustachian tube include it maintains the middle air pressure with the atmospheric air pressure. If this tube is blocked, the middle air pressure will be less compared with the atmospheric air pressure, so it's very important to maintain the air pressure. And if any secretions are there in middle ear, it is drained through the Eustachian tube to the nasopharynx, and it also prevents infection from going into the middle ear, from going from the nasopharynx to the middle ear, as middle ear is more prone to infections. Okay guys, but in infants, this Eustachian tube is very short, and it is about 16 to 18 mm in length. Almost it is horizontal, so they can easily infected with infections. The middle ear is infected with infections, but adult Eustachian tube is 36 mm in length, and it is placed at an angle of 45 degree. Okay guys, another important function is this as we breathe and expire, some amount of carbon dioxide is coming through the nasopharynx and into the Eustachian tube and into the middle ear. So it gives more carbon dioxide and less oxygen for the middle ear mucosa, so it prevents growth of aerobic bacteria growth. Okay guys, and the Eustachian tube is closed by Ostman's pad of hat and another muscle, which is tensor valley palatini, which opens during swallowing and yawning. Hey guys, you can see this is the Eustachian tube, which is closed here and opened here. This is the Ostman's pad of fat, which will be less in children and will be more in adults. These are surrounded by muscles called tensor valley palatini, levator valley palatini. During yawning and swallowing, this muscle gets contracted. You can see the arrow here, so it causes the opening of the Eustachian tube. This is the normal functioning. Okay guys, next we coming to the function tests of the Eustachian tube. Okay, another important point, this cartilaginous point, this end tip is known as the torus torsicus. Okay guys, okay, then Eustachian tube, first we going to see the non-physiological test. That is, we need to give it's a passive test. We need to create a positive pressure to see this tests. Okay guys, in this test the tensor valley palatini is not involved guys. First one is the Valsalva test or Valsalva maneuver. In this test, the patient is asked to close the nose and blow the cheeks. During this process, a positive pressure is created in the nasopharynx, which causes air enter into the Eustachian tube and reach middle ear, which causes pop-up sound due to bulging of T membrane. This pop-up sound or bulging can be seen with otoscope, or when we can be heard by auscultation in the external ear. Next is the police test. It's applied for children who can't perform the Valsalva tests. Not only children, can be performed for anyone who can't perform Valsalva. This polyester bag is connected to a rubber tube, and it is placed on one nostril and the other nostril is closed. Air is blown with some pressure. Air enters nasopharynx and creates positive pressure. It opens Eustachian tube, enters middle ear and pops out tympanic membrane, which can be heard with auscultation. The third test is the Eustachian tube catheterization, where this Eustachian tube catheter is got into the nasal cavity and into the Eustachian tube. This process is very important. For that, we need to see this Eustachian catheter, which has a soft end. In the direction, at the same direction of the soft end there is a ring, so we can identify which direction we are going on. Ring attached tells the direction of the curve. This process, let's see this explained. This Eustachian tube catheter is inserted in the nasopharynx. It is rotated to the medial side 90 degree and pulled back. When it got stuck to the wall and pulled back. Okay guys, then the catheter is rotated up to 180 degrees. Then this enters Eustachian tube. Now we can connect this to the Pulitzer bag, as we see in this Pulitzer bag, and we can blow up the air. So this causes pops up the tympanic membrane. This can be seen using otoscope, and we can auscultate in the middle ear. Next we see about the active test or physiological test. Here no need to create any pressure, the negative pressure is already present there. First one is the Toynbee's test. Now you ask the patient to close the nose and swallow small amount of liquid. This liquid flow causes us negative pressure in the nasopharynx, causes tensor valley constriction. Here in the active test, physiological test, this tensor valley comes into action. This causes Eustachian tube action. Due to this contraction, air is sucked into the middle ear. So out of the middle ear, so no air is present in the middle ear. It causes retraction of the tympanic membrane, and movement can be seen with otoscope examiner. Next is the tympanometer, which is a very important step. It uses both the non-physiological and physiological test. First, for inflation, it is performed by Valsalva test. A device is placed in ear. This device is placed in both tests, and that Valsalva is performed. Air enters middle and TM bulges out. Pressure in EAC rises, and it is noted. In deflation test, it is Toynbee's test is used here. You can see this is Toynbee's test. Here patient is asked to swallow against this instrument or device is placed here, and the patient is asked to swallow against closed nose. So this causes a deflation or negative pressure, and it can be recorded in both inflation and deflation can be recorded in this device. And you can see next you can see the test for perforated tympanic membrane. In case of perforated tympanic membrane, we need to identify whether the Eustachian tube is blocked or opened. For this we can do a radiological test. If we need to give a radio opaque dye into middle layer in the perforated tympanic membrane, we should take the X-ray, and we can see the route of the dye going through the Eustachian tube to reach the nasopharynx. Or we can also give saccharin or methylene blue test, where the methylene blue is given in the perforated tympanic membrane in the middle layer. The dye comes out to the nasopharynx and oropharynx through. Okay guys, this saccharin produces sweetness, so it can be felt by the patient. Next is the CT scan. If in both these conditions, it shows that there is perforated tympanic membrane. Next is the CT scan. It is used to find the patulous or patent Eustachian tube. Now this shows here a large amount of air is present in the Eustachian. This is normal, where there is no gap. Patent means it's always open. This is seen in predisposing conditions like thyroid disorder, pregnancy, and rapid late birth patients. In this condition, the patient will have autophony, that is, they can hear their own voice, they can hear their own breathing sounds. In this unit, the injection is the silicone paste. Next is the sonotubometry, where a microphone is placed in the ESC, and it can be heard in the nasopharynx Eustachian tube. Okay guys. Next, the Eustachian balloon dilatation. This is used to open Eustachian in chronic constriction or stenosis patient. It's obstructed the Eustachian tube. In these cases, a balloon catheter is inserted and it is inflated. This causes a fracture of microfractures of Eustachian tube, and it breaks the stenosis and open blocked Eustachian tube, and it will remain open afterwards. Let's through the disorders of Eustachian tube, guys. First, the tubal blockage can be either mechanical obstruction or functional obstruction. This mechanical obstruction may be due to any intrinsic causes like inflammation or allergy, extrinsic causes like tumor in nasopharynx or adenoids. Whereas functional obstruction is due to the collapse of the tube due to cartilage compliance, or due to poor function of the tensor valley palatini. The symptoms of tubal occlusion may be otalgia, hearing loss, popping sensation, tinnitus, and even vertigo can be there. The signs can be seen include retracted tympanic membrane, as we saw in the negative tests, congestion in the handle of Malleus, persistence or translate behind the tympanic membrane. can see tympanic membrane is markedly retracted with hemorrhages in superficial layer. In other disorders include adenoids due to the infection of the adenoids. Then it may spread to the eustachian and causes blockage or reservoir for pathogenic organism, or it can be a cleft palate which is the causes the transverse valley parental muscle does not insert into the torus tubaris, which is the cartilaginous end, so it may produce a disorder in Eustachian tube, and Down syndrome is associated with the poor tone of transverse valley palatini, and then barotrauma or pressure trauma. There may be retraction pockets in the retraction obstruction causes the retraction air retraction pocket in the tympanic membrane. We saw above the patulous Eustachian tube where the abnormally open, as we saw rapid weight loss, pregnancy, multiple sclerosis, hearing own voice, autophony, and the final examination of Eustachian tube. On the pharyngeal end, we can see it through the posterior endoscopy, which is the most commonly used method. We can go through nasal endoscope and a flexible nasopharyngoscope. The tympanic end can be seen with microscope, endoscope, otoscope. We can see the tympanic membrane in otoscope. Retraction package will also be seen. Another test we saw Valsalva test, Tony B, politicization, catheterization, endoscope. Thanks for the video, guys. Let's meet in the next section.